15 signs that your kidneys are failing. Today, we're going to discuss an extremely important health topic, the kidneys. They play a vital role in our bodies by filtering waste and toxins from the blood, regulating blood pressure, balancing electrolytes, and producing essential hormones. But how can you tell if something is wrong with your kidneys? In today's video, we will cover 15 signs that your kidneys are failing. Pay attention to each one and stay until the end because sign number 13 is something many people have and don't realize. Let's begin. What are kidneys for? The kidneys are essential organs for maintaining overall body health. They are located in the lower back, below the rib cage, one on each side of the spine. Each kidney is about the size of a fist and contains about 1 million small filtering units called nephrons. These nephrons are responsible for filtering the blood, removing waste and excess water, which are excreted in the form of urine. In addition to their filtering function, the kidneys also perform other critical tasks. They help regulate blood pressure by controlling fluid volume and producing hormones like renin. The kidneys also maintain the balance of electrolytes, such as sodium, potassium, and calcium, which are essential for normal cellular function. Additionally, the kidneys produce the hormone erythropoietin, which stimulates the production of red blood cells in the bone marrow, and activate vitamin D, which is crucial for bone health. What causes kidney problems? 1. Chronic diseases. Diabetes and hypertension are the main causes of chronic kidney diseases. High blood sugar levels can damage the blood vessels in the kidneys, while high blood pressure can harm the small blood vessels and reduce kidney function over time. 2. Infectious diseases. Repeated urinary tract infections, if not treated properly, can spread to the kidneys, causing pyelonephritis, a kidney infection that can permanently damage kidney tissues. 3. Excessive medication use. Prolonged use of certain medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and some antibiotics, can damage the kidneys. These medications can reduce blood flow to the kidneys or cause toxic reactions in kidney tissues. 4. Autoimmune diseases. Conditions like lupus and glomerulonephritis can cause inflammation in the kidneys, leading to kidney dysfunction. These diseases cause the immune system to attack healthy kidney tissues, resulting in damage. 5. Dehydration. Inadequate fluid intake can reduce the kidney's ability to remove waste from the blood, increasing the risk of kidney stones and acute kidney failure. 6. Lifestyle habits. A high-sodium diet, excessive protein consumption, smoking, and alcohol abuse can overload the kidneys, leading to problems like nephropathy and kidney failure. Kidney disease can be a silent condition, often not showing significant symptoms until it is in an advanced stage. That is why it is crucial to be aware of the signs and symptoms that may indicate kidney problems. What are the consequences if you don't treat it or make changes? If kidney problems are not treated or lifestyle changes are not made, the consequences can be severe and even fatal. The progression of chronic kidney disease can lead to kidney failure, where the kidneys lose the ability to effectively filter waste and fluids from the blood. This can result in a buildup of toxins in the body, leading to uremia, a condition that can cause severe symptoms such as nausea, vomiting, extreme fatigue, and mental confusion. Advanced kidney failure may require dialysis or a kidney transplant to sustain life. Additionally, untreated kidney diseases increase the risk of cardiovascular complications, such as heart attacks and strokes, due to the negative impact on blood pressure levels and electrolyte balance. Quality of life is significantly reduced, with limitations on daily activities and dependence on intensive medical treatments. Therefore, it is crucial to address kidney problems early and adopt a healthy lifestyle to prevent severe complications. Next, we will discuss in detail 15 signs that your kidneys may be failing. Sign 1. Dry skin and itching. Dry skin and intense itching can be signs of advanced kidney disease. This happens because the kidneys are unable to maintain the proper balance of minerals and nutrients in the blood, leading to a buildup of toxins that cause itching and dry skin. The itching associated with kidney disease, also known as uremic pruritus, can be intense and widespread. The accumulation of uremic toxins in the skin can cause irritation and inflammation, resulting in persistent itching. Additionally, mineral imbalances, such as phosphorus, can contribute to itching and dry skin. Inadequate hydration and decreased natural oil production by the skin can also lead to dryness. Dry skin can crack and become more susceptible to infections, further aggravating discomfort. Sign 2. Fatigue and weakness. Healthy kidneys produce a hormone called erythropoietin, which helps in the production of red blood cells. When the kidneys fail, the production of this hormone decreases, leading to a reduction in red blood cell count. This can result in anemia, causing extreme fatigue and weakness. Anemia associated with chronic kidney disease is a major contributor to fatigue and weakness. Red blood cells are responsible for transporting oxygen from the lungs to the body's tissues. When there is a deficiency of red blood cells, the body receives less oxygen, which can result in generalized fatigue, lack of energy, and muscle weakness. In addition to anemia, the buildup of toxins and waste in the blood due to impaired kidney function can also contribute to the feeling of fatigue. These toxins can affect the functioning of cells and tissues, causing general malaise and tiredness. Sign 3. Difficulty concentrating. Kidney failure can affect the ability to concentrate and mental clarity. This occurs because anemia, caused by decreased erythropoietin production, leads to reduced oxygen flow to the brain, affecting its cognitive functions. Cognitive dysfunction associated with kidney disease, also known as uremic encephalopathy, can manifest as difficulty concentrating, memory problems, confusion, and even mood changes. The buildup of uremic toxins in the blood can affect the brain, resulting in neurological symptoms. Anemia also plays a significant role in cognitive dysfunction. The reduction in red blood cell production decreases the oxygen supply to the brain, affecting its function. The lack of oxygen can cause mental fatigue, lack of clarity, and difficulties concentrating. Sign 4. Swelling. Swelling in the legs, ankles, feet, face, and hands can be a sign that your kidneys are not functioning properly. This occurs because the kidneys cannot remove excess fluid from the body, causing fluid retention. Swelling can be more noticeable at night or upon waking up. Fluid retention occurs when the kidneys are unable to adequately filter waste and excess fluids from the blood. This leads to a buildup of fluids in the tissues, resulting in edema. Edema can be more noticeable in areas where gravity tends to pull fluids, such as the feet and ankles when you are standing, or the face and hands after a night's sleep. In addition to peripheral edema, kidney failure can also cause fluid accumulation in the lungs, pulmonary edema, leading to symptoms such as shortness of breath and difficulty breathing. This condition is a medical emergency and requires immediate treatment. Sign 5. Loss of appetite. Loss of appetite is a common symptom in people with chronic kidney disease. The buildup of toxins in the body can affect appetite and taste, leading to reduced food intake and, consequently, weight loss. Uremic anorexia, a condition characterized by loss of appetite and aversion to food, is common in patients with kidney failure. The buildup of uremic toxins can alter taste, making food taste metallic or unpleasant. Additionally, nausea and vomiting associated with kidney disease can contribute to loss of appetite. Loss of appetite can lead to malnutrition and weight loss, further weakening the body and compromising the immune system. Malnutrition is a serious problem in kidney disease patients and can negatively affect prognosis and quality of life. Sign 6. Sleep problems. Sleep problems can be an indication of kidney failure. When the kidneys cannot properly filter toxins from the blood, they remain in the body, affecting sleep quality. Additionally, sleep apnea is more common in people with chronic kidney disease. Insomnia and other sleep disorders are common in patients with kidney failure. The buildup of toxins in the blood can cause discomfort and restlessness, making it difficult to get restorative sleep. Restless leg syndrome, a condition that causes an irresistible urge to move the legs, is also common in patients with kidney disease and can interfere with sleep. Sleep apnea, a condition where breathing repeatedly stops and starts during sleep, is more prevalent in patients with kidney disease. This can lead to fragmented and non-restorative sleep, resulting in daytime fatigue and other health problems. Sign 7. Back pain. Back pain, especially in the lower back, can be a sign of kidney problems. This can be due to kidney infections or the presence of kidney stones. If the pain is intense and accompanied by other symptoms, such as fever and blood in the urine, seek medical help immediately. Kidney infections, or pyelonephritis, can cause intense pain in the lower back or sides. The pain is usually accompanied by fever, chills, nausea, and vomiting. The infection can spread to the bloodstream, resulting in a potentially fatal condition known as sepsis. Kidney stones, or renal calculi, can also cause intense pain in the lower back or sides. The pain is usually described as renal colic, a sharp, intermittent pain that can radiate to the groin. The presence of blood in the urine and the urgent need to urinate are common symptoms associated with kidney stones. Sign 8. Nausea and vomiting. Frequent nausea and vomiting can be symptoms of kidney problems. This happens because kidney failure leads to the buildup of toxins in the blood, affecting the digestive system. If these symptoms persist, it is essential to seek medical advice. The buildup of uremic toxins in the blood can irritate the gastrointestinal tract, causing nausea and vomiting. These symptoms are more common in advanced stages of kidney disease when kidney function is severely compromised. Nausea and vomiting can also lead to loss of appetite and dehydration, further worsening the patient's health condition. In addition to uremic toxins, electrolyte imbalances, such as high potassium levels, hyperkalemia, can affect the digestive system, causing gastrointestinal symptoms. Sign 9. High blood pressure. The kidneys play a crucial role in regulating blood pressure. When the kidneys are not functioning properly, blood pressure can increase. Hypertension is one of the main risk factors for kidney disease and can also be a consequence of it. The relationship between kidney disease and hypertension is complex and bidirectional. High blood pressure can damage the blood vessels in the kidneys, compromising their ability to filter waste and fluids from the blood. This can lead to fluid retention and increased blood pressure, creating a vicious cycle. Additionally, the kidneys produce hormones that help regulate blood pressure. Renin, for example, is a hormone that helps control blood pressure. When kidney function is compromised, the production and release of these hormones can be affected, leading to changes in blood pressure. Sign 10. Shortness of breath. Shortness of breath can be a sign of severe kidney failure. This can occur for two reasons: excess fluid in the body, which can accumulate in the lungs, and anemia, which reduces the amount of oxygen available in the body. If you have difficulty breathing, seek medical help. Pulmonary edema, or fluid accumulation in the lungs, is a serious condition that can occur in patients with kidney failure. When the kidneys cannot remove excess fluids from the body, these fluids can accumulate in the lungs, making breathing difficult. Shortness of breath can be more pronounced when lying down or during physical activity. In addition to pulmonary edema, anemia associated with kidney disease can also cause shortness of breath. The reduction in red blood cell count decreases the amount of oxygen available to the tissues, including the lungs. This can result in difficulty breathing and extreme fatigue. Sign 11. Metallic taste in the mouth. A metallic taste in the mouth and bad breath are common symptoms in people with chronic kidney disease. The buildup of toxins in the blood can affect taste, causing this unpleasant taste. Additionally, poor filtration of waste can result in a foul odor in the mouth. The metallic taste, also known as dysgeusia, can be caused by the buildup of uremic toxins in the blood. These toxins can affect the taste buds, altering taste perception. Many patients with kidney failure report that food tastes metallic or unpleasant. Bad breath, or halitosis, is another common symptom in kidney disease patients. Poor filtration of waste by the kidneys can result in a buildup of chemicals in the blood, such as urea, which can be converted to ammonia and cause a foul odor in the mouth. Sign 12. Muscle cramps. Muscle cramps can be caused by electrolyte imbalances, such as low levels of calcium and phosphorus, which are common in people with kidney problems. These imbalances can affect muscle function, leading to painful cramps and spasms. The kidneys play a crucial role in maintaining the balance of electrolytes in the body. When kidney function is compromised, the levels of electrolytes such as calcium, phosphorus, sodium, and potassium can be affected. The imbalance of these electrolytes can interfere with muscle function, resulting in cramps and spasms. Muscle cramps can be painful and debilitating, affecting the ability to perform daily activities. Hypocalcemia, or low levels of calcium in the blood, is a common cause of cramps in patients with kidney failure. Hyperphosphatemia, or high levels of phosphorus in the blood, can also contribute to the development of muscle cramps. Sign 13. Changes in urine. The kidneys are responsible for urine production, and any significant change in this process can indicate kidney problems. Pay attention to changes in urinary frequency, color, and smell. If you notice foamy urine, blood in the urine, or a drastic increase or decrease in urine output, it can be a warning sign. Changes in urine can manifest in several ways. Foamy urine, for example, can be a sign of protein in the urine, proteinuria, indicating that the kidneys are allowing proteins to escape from the blood into the urine. This can be a sign of damage to the kidney filters. The presence of blood in the urine, hematuria, can be visible to the naked eye or detected through urine tests. Hematuria can indicate infections, kidney stones, or more severe conditions such as kidney cancer. Changes in urinary frequency are also important. Polyuria, or increased urine production, can be a sign of diabetes or chronic kidney failure. On the other hand, oliguria, or decreased urine production, can indicate acute kidney failure, where the kidneys lose the ability to filter waste efficiently. Anuria, the almost complete absence of urine production, is a medical emergency and requires immediate attention. Sign 14. Paleness. Paleness is a symptom of anemia, which can be caused by kidney failure. The reduction in red blood cell production leads to a lower amount of oxygen in the blood, resulting in a pale and tired appearance. Anemia is a common complication of chronic kidney disease and can be caused by decreased erythropoietin production by the kidneys. Erythropoietin is a hormone that stimulates the production of red blood cells in the bone marrow. When erythropoietin levels are low, red blood cell production decreases, resulting in anemia. The paleness associated with anemia can be more evident in the skin and mucous membranes, such as the inner part of the eyelids and the tongue. The lack of oxygen in the tissues can also cause fatigue, weakness, and lack of energy, contributing to the pale and tired appearance. Sign 15. Bleeding and bruising. Kidney failure can affect the body's ability to clot blood, leading to frequent bleeding and bruising. If you notice that you are easily bruised or bleeding, it is important to seek medical advice. The kidneys play an important role in the production of clotting factors, which are essential for blood clot formation and preventing excessive bleeding. When kidney function is compromised, the production of these factors can be affected, resulting in a greater tendency for bleeding and bruising. Thrombocytopenia, or low platelet levels in the blood, is a common complication of kidney disease and can contribute to the ease of bruising and bleeding. Platelets are blood cells that help in blood clotting and clot formation to stop bleeding. How to keep your kidneys healthy. These are the 15 signs that may indicate your kidneys are failing. If you identify one or more of these symptoms, it is crucial to seek a doctor for a complete evaluation. Remember that early detection can make all the difference in treating kidney disease. Taking care of your health is essential for a long and healthy life. Maintaining good kidney health involves several preventive measures, such as maintaining a balanced diet, controlling blood pressure, avoiding excessive use of medications that can harm the kidneys, and undergoing regular checkups to monitor kidney function. Additionally, it is important to stay hydrated and adopt a healthy lifestyle, including regular physical exercise and abstaining from smoking and alcohol. Kidney disease can be a devastating condition, but early detection and proper treatment can help control the progression of the disease and improve patients' quality of life. If you or someone you know is showing any of these signs, do not hesitate to seek medical help. Your health is the most precious asset you have, and taking care of it should be a priority. Don't forget to like, share this video, and subscribe to our channel for more informative content like this. See you next time.